The wall of the uterus consists of 3 layers, which can be seen in this histology slide. The layer adjacent to the lumen, which is represented in this white area, is called the endometrium. The middle layer is the myometrium and can be seen from here to there. And the outer layer is the perimetrium, which is the thin layer located here. We'll begin with the endometrium. It consists of simple columnar epithelium and lamina propria. The lamina propria is connective tissue and can be seen in this area here. In addition, there are endometrial glands that secrete a glycogen-rich substance that will be used as a nutrient for the conceptus. The conceptus is the developing offspring. The endometrium consists of 2 layers. The functional layer is adjacent to the lumen and can be seen here. This layer changes throughout the month in response to ovarian hormones. It is also the layer that is shed during menstruation. The deeper layer is the basal layer, located here. This layer replaces the functional layer, or generates it. The main blood vessel supplying the uterine wall is the uterine artery, which is a branch off of the internal iliac artery. This blood vessel continues to branch until ultimately you get to the spiral artery. The spiral artery supplies the functional layer of the endometrium. The myometrium is the middle layer and it consists of smooth muscles. These cells have receptors for the posterior pituitary hormone oxytocin. Oxytocin causes the smooth muscles to contract during labor. The outer perimetrium is parietal peritoneum. The uterus undergoes cyclic changes during the month in response to the ovarian hormones estrogen and progesterone. It is also known as the menstrual cycle, and there are 3 phases. It will occur over a period of 28 days. The first phase is the menstrual phase, which occurs on days 1 through 5. The second phase is the proliferative phase, which occurs prior to ovulation, days 6 through 14. Recall that ovulation occurs on day 14 of the ovarian cycle. Following ovulation, the proliferative phase moves into the secretory phase. This will occur between days 15 through 28. During the menstrual phase, menses occurs. Menses is menstruation or a girl's period. A female's first menses is called menarche. During menses, the functional layer of the endometrium is shed in response to low progesterone and estrogen. Recall that after ovulation, the remaining follicle becomes a corpus luteum. It will release progesterone, estrogen, and inhibin. The corpus luteum will continue to release progesterone and estrogen for 10 days. If pregnancy does not occur, the corpus luteum disintegrates and the levels of progesterone and estrogen in the blood drop. In response to the decreased levels of estrogen and progesterone, the functional layer is shed. Bleeding occurs for 3 to 5 days. LH is released from the anterior pituitary in response to the decreased levels of estrogen and progesterone. A new cohort of primordial follicles will begin to mature. As they mature, they release estrogen. Estrogen levels will begin to increase in the blood. Estrogen binds to receptors on the basal cells of the endometrium. In response to estrogen, the basal cells begin to produce a new functional layer. This occurs between days 6 to 14 and is called the proliferative phase. The endometrium becomes thick and the spiral arteries begin to grow and increase. In addition, the uterine glands enlarge so that they can begin to secrete the glycogen-rich substance. These actions prepare the endometrium for the conceptus. In addition, the estrogen stimulates endometrial cells to express progesterone receptors. The cervix is the inferior-most part of the uterus. The opening into the cervix is called the external os, and it is covered by a cervical mucus. In response to estrogen, this mucus thins and creates channels allowing for sperm to enter the uterus. On day 14, ovulation occurs. Following ovulation, the functional layer continues to grow and becomes a secretory layer. This is called the secretory phase. Between days 15 to 26, the endometrium continues to thicken and prepares for the embryo, should pregnancy occur. The cervical mucus, in response to the progesterone, becomes thick once again or viscous, closing off the entrance into the uterus to protect the conceptus. This thickened cervical mucus is called the cervical plug. Increased levels of progesterone will inhibit the release of LH. If pregnancy does not occur, a drop in LH will cause the corpus luteum to disintegrate. This will result in a decrease in progesterone and estrogen. In response to a decrease in progesterone, the spiral arteries are going to kink. This prevents blood from being supplied to the functional layer. The lack of blood will cause ischemia, or decreased oxygen to the cells, and they will die. In response, the spiral arteries will dilate, releasing the blood that has accumulated in them. Menstruation occurs and the functional layer with the blood is shed. This begins on day 28. Recall that this is a cycle, so this will lead into the menstrual phase. Finally, let's look at fertilization. A secondary oocyte is viable for 12 to 24 hours, whereas a sperm is viable for 3 to 5 days. Fertilization usually occurs in the ampulla of the uterine tube or fallopian tube.